Have you ever wondered how doctors repair blocked arteries in the heart? Today we're diving into the fascinating world of angioplasty, a life-saving medical procedure that plays a vital role in the battle against heart disease. Heart disease is a prevalent issue, impacting millions of lives worldwide. According to recent data from reputable sources like PubMed and the American Journal of Science, heart disease is a leading cause of death globally. This is where angioplasty steps in, providing a ray of hope in this grim scenario. Angioplasty, in its simplest terms, is a procedure used to unblock the arteries that supply blood to the heart. It's a beacon of modern medicine, helping to restore blood flow, alleviate chest pain, and even prevent heart attacks. Understanding the importance of this procedure and how it works is informative and empowering. After all, knowing how angioplasty works might just save a life, maybe even yours. So, let's get started and explore this life-saving procedure together. So what exactly is angioplasty? Angioplasty is a medical procedure designed to improve blood flow in the body's arteries. Imagine your arteries as highways for your blood. Sometimes these highways can get blocked due to the buildup of plaque, making it hard for blood to flow smoothly. This is where angioplasty comes into play. Think of angioplasty as a roadwork crew working to clear up the traffic jam in your arteries. A doctor inserts a thin tube called a catheter into the blocked artery. At the tip of this catheter is a tiny balloon. This balloon is then inflated to push the plaque against the artery walls, widening the pathway and improving blood flow. Now you might be wondering, how did we come up with such a procedure? Well, allow me to introduce you to a study from PubMed titled Percutaneous Coronary Intervention, Past, Present, and Future. This study provides a comprehensive history of angioplasty. In the early days, angioplasty was a relatively simple procedure, but it was not without its challenges. The first successful angioplasty procedure was performed in the late 1970s. Since then, the procedure has seen several advancements, including the use of stents, which are small wire mesh tubes that are left in the artery to prevent it from closing up again. Modern angioplasty procedures are safer and more effective than ever before, thanks to advancements in technology and surgical techniques. The procedure has come a long way from its inception over 40 years ago, and it continues to evolve with ongoing research and development. Angioplasty is a perfect example of how medical science constantly strives to improve patient care, using innovative techniques and technologies to treat conditions that were once considered untreatable. It's fascinating how such a small device can make a huge difference, isn't it? Now, let's delve into the science behind this life-saving procedure. Angioplasty is a fascinating blend of biology and physics, designed to restore blood flow in blocked arteries. But how exactly does it work? Well, it all starts when a narrow catheter is threaded through the patient's blood vessels until it reaches the site of the blockage. At the tip of this catheter is a small, deflated balloon. This balloon is the heart of the angioplasty process. Once the balloon reaches the blockage, it's inflated. This inflation exerts pressure on the plaque buildup within the artery, pushing it against the artery walls. This action widens the artery, effectively restoring blood flow. But what happens to the balloon? As soon as its job is done, it's deflated and removed from the body, leaving behind a more open passageway for blood to flow. But let's dig a little deeper. According to an article in the American Journal of Science titled The Mechanics of Angioplasty, Understanding the Response of the Coronary Artery, the success of the procedure relies heavily on the interplay between the balloon's pressure and the elasticity of the artery. Too much pressure, and the artery could be damaged. Too little, and the blockage may not clear. The science of angioplasty is all about finding that sweet spot, and it doesn't stop there. Sometimes a stent is placed in the artery during the procedure. This tiny mesh tube acts as a scaffold, providing extra support to the artery walls and preventing the artery from narrowing again. So in essence, angioplasty is a delicate balancing act of force and flexibility, a testament to the incredible advances in medical technology. It's a procedure that combines the principles of physics with an in-depth understanding of the human body to save countless lives each year. In conclusion, angioplasty is not just a simple case of inflating a balloon in an artery. It's a complex and meticulously calculated procedure that showcases the marvels of modern medicine. It's truly a marvel of modern medicine. Like any medical procedure, angioplasty has its risks and benefits. Let's dive into the risks first. As with any procedure, there's always a chance of complications. These could range from minor issues like bruising at the catheter insertion site to more serious ones, such as damage to the blood vessels, heart attack, stroke, or, in rare cases, death. There's also a chance that the artery could narrow again, leading to a need for repeat procedures. A study published in PubMed titled Risks and Benefits of Percutaneous Coronary Revascularization provides an in-depth look into these potential risks. Now, this may sound daunting, but remember, these risks are generally low, and your healthcare team will always weigh these against the potential benefits before recommending the procedure. Speaking of benefits, let's flip the coin. The most obvious benefit of angioplasty is improved blood flow to the heart. This can lead to reduced chest pain, increased ability to participate in physical activities, and a better overall quality of life. For some, this procedure can be a lifesaver, preventing heart attacks or reducing their severity. But the benefits aren't just physical. There's a psychological aspect too. Imagine the relief of knowing that a blockage in your heart has been cleared, that you're less likely to have a heart attack. This peace of mind can be invaluable. It's important to note, though, that while angioplasty can alleviate symptoms and save lives, it's not a cure for heart disease. It's part of a larger treatment plan that includes lifestyle changes like a healthy diet, regular exercise, and medication. So, is angioplasty worth it? Well, that's a decision you need to make with your healthcare team, taking into account your unique circumstances, health condition, and the potential risks and benefits. Informed decisions are always the best decisions, don't you agree? So, that was a quick deep dive into the world of angioplasty. We've journeyed together through the intricacies of this fascinating medical procedure, from its fundamental definition to the scientific principles that make it possible. We've also delved into the potential risks and benefits, providing you with a balanced perspective. We've uncovered the layers of this complex procedure, using the most recent Google statistics and reliable citations from resources like PubMed and the American Journal of Science. Our aim has been to present you with the most accurate and up-to-date information, so you can deepen your understanding and spark your curiosity. If there's something that piqued your interest, or maybe there's a question that's been niggling at your mind, don't hesitate to drop it in the comments section. We value your thoughts and queries as they help us create more engaging and informative content. Plus, it's always great to see a lively discussion or two brewing in our community, and if you found this video helpful or know someone else who might, do share it. It's a simple way to spread knowledge and potentially help others who might be seeking this information. Now, if you've enjoyed this journey as much as we have and you're hungry for more, make sure to hit that subscribe button. Join our Facts Academy 0122 family, where we strive to make learning accessible and enjoyable. We've got a cornucopia of educational content waiting for you, and we're always adding more. Let's not forget, this channel is not only for bachelor students, it's also kid-friendly, so you can share it with your younger siblings, cousins, or even your kids. Let's make learning a fun-filled adventure for everyone. Thank you for spending time with us today. Remember, knowledge is power. Until next time, stay curious and keep learning. As we've discussed the intricacies of angioplasty, it's crucial to know where you can receive the best care should you or a loved one ever need it. In this segment, we'll explore some of the top hospitals globally recognized for their excellence in angioplasty and heart health treatments. From pioneering medical practices to exceptional patient care, these institutions set the benchmarks in healthcare. First on our list is the Cleveland Clinic in the United States, renowned for its cutting-edge cardiovascular treatment and research facilities. The clinic boasts a team of world-class cardiologists and has been ranked as one of the top hospitals for heart care for more than 2 decades. Crossing over to Europe, we find the Charité Hospital in Berlin, Germany. With a history of medical innovation, Charité stands out for its advanced research contributions and comprehensive treatment options in cardiology. Back in Asia, the National University Heart Center in Singapore offers state-of-the-art facilities and is at the forefront of cardiac care in the region. Their holistic approach to treatment and recovery has received international acclaim. We also take you inside the Royal Brompton Hospital in London, which specializes in heart and lung disease treatments. Known for its clinical expertise and research in cardiology, Royal Brompton provides tailored care that addresses the unique needs of each patient. To give you a closer look at what makes these hospitals stand out, we've included interviews with some of their leading cardiologists. They share insights into their approaches to angioplasty, the latest advancements in technology, and how they ensure the best outcomes for their patients. Furthermore, hear firsthand from patients who have undergone angioplasty at these facilities. Their testimonials highlight the compassionate care and transformative health experiences they've had, underscoring the importance of choosing the right hospital. As you consider these top-tier medical facilities, remember that the quality of care can significantly influence recovery and outcomes in heart health treatments. Whether you're seeking treatment now or in the future, knowing where to find the best care can be a crucial step towards a successful recovery. Stay tuned as we continue to bring you reliable and informative content. Your health and well-being are our top priority, and we're here to help you navigate the complex world of medical treatments. Remember, when it comes to your health, being well-informed is key.